This is To the Point with Michael Williams.
Good morning. The COVID-19 vaccines are coming, and with them hope for the beginning of the end of a pandemic that has shaped 2020 in ways we could never have imagined. This week, a restaurant worker reminded us of the human equation here. With so many jobs sidelined, she thanked Governor Ron DeSantis at a news conference at Okeechobee Steakhouse in West Palm Beach for supporting Florida's restaurant industry.
Single mom of 2 kids, no other income coming, so sorry about this. Very blessed to have Governor DeSantis keeping us open. Very blessed to be able to work with Curtis and Ralph and how they pushed everything, so I would have lost everything.
Also, too, a reminder of the challenges and debates still ahead in 2021, with the pandemic far from tamed yet. Most states have mask mandates. Florida is one of about a dozen that does not. I asked Governor Ron DeSantis at that restaurant news conference about his stance. Scientists have argued to us again and again.
It doesn't matter what they argue. What are the facts? So first of all, I don't believe in mandates.
They say the facts are that mask wearing does help and that
That's
a mandate would help.
That's not the same thing as a mandate, though. Whether you wear it or not is not the same as
a mandate.
But
why not mandate it?
Because of the states that are ahead of us, 40 states that have higher caseloads, 40 states that have higher per capita hospitalizations. We're in the bottom 10 states for per capita cases, and this is with being open for months and months. So the question is, why are cases exploding in California? Why are hospitalizations exploding in other parts of the country, particularly states that have said that they've done all these great restrictions and mandates? The mandates, I don't think, have been effective.
A contrasting point of view coming up now. My guest this morning, West Palm Beach infectious disease specialist, Dr. David Dodson, a familiar face and voice over the course of this year. We began first talking about vaccine availability and distribution for our community.
Well, our vaccines are a remarkable achievement. It was really just about a year ago that the very first cases of a new viral illness in China were noted. And so to come a year later and to go through all we've been through and have vaccines, it's a remarkable achievement in science. We've spent $24 billion and, we seem to not hesitate to spend money, but we hesitate to enforce very simple things like mask wearing and social distancing, which, we would be much safer if we did both. Anyway, so the vaccines are arriving, thank goodness. But we've heard 180,000 doses of the Pfizer vaccine are coming to Florida. Presumably, the Moderna vaccine should be approved, and then that'll be shipped. That's a little more stable, so that'll be easier to distribute toward doctors' offices and pharmacies and such. But keep in mind that when you have these numbers, we're talking hundreds of thousands of doses of vaccine, and you have to divide them by 2 because each person gets 2 doses. So we have 1.3 million health professionals in Florida, including doctors, nurses, and CNAs. And we have 145,000 people living in long-term care facilities. And we have over 4 million people over the age of 65. So those are the highest priority groups, but the vaccine rollout will take time to vaccinate all those people.
For Palm Beach County, there was concern expressed by commissioners last week. We weren't in the initial 5 hospitals where the Pfizer vaccine went. I know it changes day by day, but where does our community stand in terms of getting its first vaccines and being able to start rolling them out?
Well, the initial problem was that the Pfizer vaccine requires extreme cold. So they designated certain spots basically as test centers to start the process. But every community will be able to have, extremely cold refrigerators and accept the virus. So as more Pfizer virus vaccine becomes available, it'll be more widely distributed.
So we'll start seeing that rolling out in the next couple of weeks in our communities here.
The Pfizer vaccine, and then more likely the Moderna vaccine, which doesn't require the cold. It's more stable, and that'll be able to be distributed more widely.
Are you in line for a vaccine? Will you get it without hesitation?
From the data I've seen, through the FDA, yes, the vaccine seems to be safe and effective. We haven't seen many major side effects. Some people do feel fever, site injection, pain, muscle aches, and but no major side effects to date. So yeah, I wouldn't hesitate in taking a vaccine.
Surveys, and will you, as somebody, an infectious disease specialist, as one of our doctors, will you be in line to get it relatively early on?
Yes, I'm also over 65, so so I qualify on two fronts, I guess. So yes, I should be in the relatively higher groups. So, but we'll see. I'll wait my turn though.
Absolutely. And thank you for being on the front lines along with so many other heroes this year. Surveys do suggest so many Americans are still skeptical about getting the vaccine. What do you say to those who say either, boy, I'm really scared. They came out Operation Warp Speed, came at dizzying pace. I'm still not sure whether it's too fast. Others who outright say, I just won't get it. What do you say to that concern, that skepticism?
Well, the term warp speed was a little unfortunate in terms of vaccine when we want to reassure people that it's safe and effective. But I think people need to understand that it has been scientifically vetted, that very smart vaccine people have gone over the data and have found it to be safe and effective. And we're gonna beat this pandemic two ways. Either people are going to get infected and some of them will die, or people are going to get vaccinated. So the sooner we all get vaccinated and get up to that herd immunity where the virus can't transmit as readily, the sooner this whole thing will be over. So yes, maybe some people are listening to certain media that tell them differently, but the science says that the vaccine is safe and effective.
We'll leave an optimistic note for the end of the interview here as we point to 2021. I want to talk about a few points. We're not out of the woods, clearly. We heard a restaurant worker who expressed the toll it has taken on so many people's emotions and many their paychecks, their livelihood. She's thankful to have a job, thankful that Governor DeSantis is keeping the restaurant industry open. You still have that challenge, that very human need balanced against some of the concerns you have. Speak to that. A lot of people say, listen, I understand COVID. I understand we're not out of the woods yet, but I've got to work.
Well, absolutely. Our population, this whole pandemic has been based on our own behavior. So the virus can only replicate and infect. That's all it can do. Humans can do a whole bunch of things to prevent transmission. So it depends. The sooner we all stop getting infected and get vaccinated and stop letting the virus transmit to each other, the sooner this whole thing will be over. So I understand that we need to have a public health standpoint, and we also have to have a livelihood standpoint. But if you do open your business or anything, it has to be done responsibly, and we have to stop transmission.
The governor said there's a difference between a mask mandate and people wearing masks. And to the mandate itself, he says, just don't believe a mask mandate would work. And that's my stance. And he's not changing that stance.
Well, I've heard the government say that he doesn't believe mask mandates work. But if you talk to every other scientist, epidemiologist, infectious disease person in the United States, if you talk to world people in other countries, countries that have successfully contained COVID, like New Zealand, South Korea, all those other countries, they will say that masks do work. So it's time to just let that go.
His argument is a mask can work, but a mask mandate's not going to be effective in terms of enforcement on and on and on. He said there's a difference there between wearing them and mandating that you wear them.
Well, mandate, strongly encourage, ask, whatever it is, people have got to wear the masks.
And we're heading into the Christmas holiday season. Thanksgiving was a concern. What is your advice to people who are considering travel or getting together with sizable groups for the upcoming holidays?
Yeah, so even with the vaccine on the horizon, it's going to be a while. Even if you've been vaccinated, well into the next year, we're going to be still recommending masks and social distancing. So with the upcoming holidays, we've learned that in-home transmission is an extremely important way that this virus is spreading. So we're going to have to again recommend no large holiday gatherings, no air travel to see your family. I'm sorry, and we have to stop the household transmission and the transmission that's going on right now. Because once we cut down the cases, then the deaths and the hospitalizations will go down.
As we point to 2021, after a year that none of us could remotely have imagined at the start of 2020, ended on an optimistic note as best you can with the real world concerns that you rightly have pointed out. And I want to thank you all year long. You've been a thoughtful voice for our audience, but your thoughts as we point to 2021.
Well, you're very kind, and thank you. So yes, I am optimistic because how this pandemic goes depends on our behavior. And so each of us has to make up our minds that we're going to help our entire society get through this. So by listening to the science experts, by doing the things that they're recommending, like masks and social distancing, getting that vaccine, the sooner we all do that, the sooner we're going to get through this whole pandemic. And I look forward to next Christmas and to next Thanksgiving, where we will be able to have a normal life. But we have to hunker down and get through this part right now. But there are better days ahead.
Ahead, our roundtable talks pandemic response and Mar-a-Lago. Will a new dispute keep it from being President Trump's permanent post-White House address?